the YouTube live and Insta live both, because sometimes in Insta live we deal only with rubrics and less of question answer sessions, and in YouTube live more of question answer sessions rather than the rubrics and the matter medica. So if there are no questions, I'll just first of all give you some inputs about some questions which are basically asked very frequently to me in relation to female genital organs, especially menses problem and leukorrhea problem. Now, what happens? There are some symptoms, of course. If the leukorrhea symptoms are very pronounced or very defining of a person, of a lady, then only I'll take it for prescription. Otherwise, sometimes leukorrhea is a bit common and it comes and goes automatically by itself. Now, I had a case where the patient came to me for the white discharge and leukorrhea problem, and the patient had a very typical symptom, that it was leukorrhea, that it was itching, it was sometimes painful, and it was too much. She had taken a lot of medicines, but there was no relief. She got only relief when she takes the medicines. She came to me also. I prescribed few medicine, but it was not getting cured. The patient was temporarily better, and then again back to square one. Now I asked her something in detail about apart from the itching, apart from the leukorrhea, which was lumpy, that was itching, it was flowing down, it was sometimes during menses, sometimes after menses. We tried a lot of things, but there was the results were not so promising. I just asked her to define how she feels when she has leukorrhea, and she had a very interesting symptom that she says, sir, wherever the leukorrhea is coming, it feels as if fire is coming. It is very hot. And now I got a very interesting symptom, that the leukorrhea is hot. And the second symptom was that the leukorrhea was hot and it was like fire running out of the part. When I looked at the repertory, I found one remedy, that is Guaiacum. Now, I have never used Guaiacum in my life for leukorrhea because it is a very, very interesting remedy for arthritis and joint pains and pain in the limbs and all. Lot of symptoms related to extremities. So when I found it that there are some questions on the YouTube, on the Insta, on the WhatsApp, please do this only on the on the YouTube live. So I saw first of all surprisingly it was Guaiacum, and I prescribed the patient simple dose of Guaiacum 30, and gradually in a span of 2 months I changed to Guaiacum LM potency, and then automatically the patient was better. Now the interesting thing to tell you is that whenever you get a very defining feature of that leukorrhea, then only try to prescribe the medicine. Now Guaiacum, if you see, I have only this symptom to tell you. Guaiacum has leukorrhea which is hot like fire running out, or the leukorrhea is hot. In the same instance, I will tell you something in relation to other types of leukorrhea which I have treated well with homeopathy medicines and have got good results. One of the patient had a very interesting leukorrhea symptom, that the leukorrhea was very thick brown color, and I asked her to describe it. What do you mean by thick and brown color? And the patient said, she told that, doctor, it is like, you have seen honey. It is like honey. And immediately I went to the repertory. I tried to find out the symptom, leukorrhea honey colored, and there was only one remedy, and that was natrum phos. Now again, natrum phos I had never used before for leukorrhea, but natrum phos simple. In that case also I used 30 potency, and the patient was better with natrum phos. Just one thing that comes to my mind, I had a case where the patient was having leukorrhea problem for the past 2 to 3 years, and what happened, that she had taken a lot of medicines, and she had taken medicine from me also, and she had only one symptom which was very, very pronounced, and she was telling me that leukorrhea is very dirty, बहुत गंदा है, it is dirty. And I tried to describe what is dirty? Dirty, I did, but she was saying dirty. It is like dirty water and brown water. Sometimes this water, that water, offensive also. And I tried to ask her, can you describe dirty? And one day suddenly she told me it is like meat water. When we wash meat, she was a Muslim lady, and she told that when I was washing the meat, the water that comes out, no, that is the leukorrhea. And I was happy that now I have a symptom which is very very interesting. And then I asked her when is the leukorrhea, and she said it is more before the menses, and she feels very weak and all. So I thought maybe the weakness was in relation to menses, but in this case the weakness was in relation to leukorrhea. If you see the repertory, if you see the Mater Medica, there are a lot of drugs, but I prescribed the patient because of weakness before menses and meat like leukorrhea, and the remedy was Cocculus indicus. Cocculus. Now, Cocculus does have the symptom of leukorrhea, but I had not prescribed Cocculus for this symptom. And these are the 3 or 4 examples, where you feel that if you have a very correct interpretation of symptom, if you have correct interpretation of symptoms, automatically your remedy starts working within days, sometimes within hours also. So I hope this is well enough for leukorrhea. Now you can have leukorrhea in different types, like leukorrhea is creamy, it is lumpy, there is itching, and sometimes frothy, gushing, jelly-like, milky, offensiveness, and it has lots and lots of remedies in that. So sometimes you get confused what to prescribe and what not to prescribe. For example, leukorrhea like fish burn like. Now, very important if the patient can tell you the symptom, but sometimes the patient can only appreciate it is offensive. So in this case, then you have to take a grand rubric and then come to a remedy, or understand whether the leukorrhea is before menses, during menses, or after menses. If I remember, I had one more case that the patient had leukorrhea problem, and she told, sir, whenever I have this problem, leukorrhea, nobody can go in the bathroom. I have to go in the bathroom, I have to wash the bathroom for 1 or 2 hours, the smell is there, and it is a very bad smell. The patient could not describe the smell, but she had only one symptom, that nobody can use the bathroom for 2 or 3 hours. I have to wash the bathroom. In fact, if it starts in the room, my husband cannot sleep in the room if the leukorrhea is there. And then the patient, I was just searching the remedy and the Mater. I got a remedy where the leukorrhea was pungent. I took the rubric leukorrhea pungent, and creosote treated that case. So again, I would like to tell you that interpretation of symptoms of what the patient is telling you in any disease, whether it's leukorrhea or it's menses or it is coryza cough, anything, is very very important. Repertory has lot of it in, but sometimes you have to see how the patient is able to describe that symptom. That is important. Okay. So I was just telling something about leukorrhea. A lot of have joined. Welcome, Dr. Disha, Dr. Vishaka, Dr. Badwaik, Dr. Khan, Faisal Khan. Yeah. So one question which I can see: how to manage spinal cord stenosis cases? Suggest medicine. Now see, first of all, in case of spinal cord stenosis, where you feel that the spinal cord has already been stenosed, one thing is very important: physiotherapy. Because when the disc has, the spine has stenosed and the nerve is involved, physiotherapy is very very important. If the patient does physiotherapy, then the results are very promising. Otherwise, only with medicine sometimes it would get difficult, because you can't open mechanically with the medicines. No. So physiotherapy is a must, and I have found fantastic results when the patient does physiotherapy with homeopathy. Now, there are few medicines which are very very common in spinal cord stenosis. First, let me tell you that I have a lot of cases where I have treated, and I have been very successful in treating spinal cord stenosis cases, and the operation was taken care of. No need for the operation also. Few remedies which are important you must think about. First of all, phosphorus, then we have plumbum, then we have phytolacca, then we have silicia, then we have arnica, then we have macphos. Very very common remedies. But again, If you have common remedies, and then you have to understand, normally in case of spinal cord problem, the pain is very, very, because the nerve is involved. So how does the patient have pain? Most of the pain, of spinal cord tenosis are basically aggression from bending, from walking on uneven grounds, on climbing. These are very, very common symptoms of spinal cord complaints and pain. You have to look. Now we have cases where the patient says that, I have pain in the spine, and the pain is generally more if she's a lady before menses, during menses, after menses. Then you can go to the repertory, see the rubric, and then prescribe the remedy. Lot of patients comes and tell you the pain is like electric shock, like it is so much that I cannot bend. The pain is so much that I have to stand and I cannot move. So in that case, plumbamide, zincum phos, rustox, ruta are very, very important. Some of the patient can come and tell you that, sir, I have the pain in the spine, and the pain in the spine is located in this area only. They will come and show the area also. So in spots, think about calibachrome, lacasis, fluoric acid. Some patient can come and tell you that, that whenever, I am getting up and I have to straighten my back. He has to get up. Then the pain is very more. And this symptom I have seen in my practice very, very important. That when the patient has to straighten up the back, it aggravates. In this, there are 3 remedies which I have found very, very useful in my practice. Think about natramur, think about thuja, and think about sulfur. These are the remedies which I have found. Yes, sometimes, most of the time we think about causticum, but causticum has, something very different symptom in relation to pain rather than this type of symptom. Are you with me? Sometimes the patient can come and tell you that the pain from the lumbar vertebra, pain from the, of course, spine can be cervical, can be lumbar, and can be thoracic also. But typically we have pain where the patient has pain in the cervical vertebra. Sorry, my doctors are telling that, sir, please see, there are a lot of questions. Okay, so I think spinal cord is taken care of. I'll go to the other question also. Kindly guide about your views on skin disease, use of potency, and its repetition to avoid aggravation. See, whenever you are using homeopathy medicines, and if at all LM potency is available, that is 50 millisieverts potency, if it is available, do give that. Okay, and in skin trouble, the trouble is that, for example, if you see sulfur, graphitis, petroleum, calcarea fluor, sarsaparilla, sorinum, these medicines have lot of skin symptoms which we see in our practice. So if you try to repetize more symptoms, you land up in these remedies only. In skin complaint, it is very important to understand, in skin complaint, how did the patient get the skin complaint. If you see in books, it is written that what do you call it? Skin is the mirror of sick image. Understand why the patient has developed these skin symptoms. For example, eczema, psoriasis, lichen planus, a lot of cases where you have to understand why. Second thing about the repetition. Repetition means what? If you give LM potency, you give LM1, LM2, you find that after LM3, 4, the LM3, the symptoms are increasing, stop it. So aggravation is minimal, and you can repeat if you want as and when required. So if you have the LM potency, at least the remedies given in the chronic disease, there are 48 remedies. You can call those for in your practice and start at least using LM potency. You will get very good results. Okay, so this is taken in centesimal potency, which we were using before. I used to give 30 potency, weight, then repeat 30 potency once, then 200 potency, then weight, and that depends on case to case. Okay, so let us go forward. Sir, patient of supraspinatus tendinitis due to continuous throwing ball, pain in left arm. Yeah, so I have also a lot of cases where the patient is a cricketer or a badminton player or a baseball player, what you call these type of players. So this is the first important thing is rest, because you have overused that part and the part has a problem. So give rest, because that is very very important. Second is physiotherapy, and then the routine medicines which we have: Ruta, we have Pelisper, we have Rustox, we have Macphos, Fluoric acid, Conium, Calcarea carb, sulfur, lot of medicines. Sir, kindly tell some medicines for person in the urine. You can think about simple remedies: Cantharis, Uva ursi, Terebinthina, Cannabis indica, Petroselenium, sulfur. Okay. Sir, I am not feeling hungry or thirsty. I am 30 years old. Earlier I had vomiting and stomach upset. Now the problem is fine after 7 days. So if the problem is fine after 7 days, then don't do anything. Just wait and watch. Okay. Age 78 years of female. Sorry, the question just scrolled up. Suffering from knee pain and burning sensation, worse by sitting, rising from. Yeah, so Ram Prasad ji, this is a very common problem at 78 years of age. And in this case, of my experience, of course, few cases you can try to cure it, but then at 78 years of age, the patient is already suffering from some disorders like diabetes, BP, cord compression, pain, backache, and a lot of other spondylitis. In this case, you can temporarily relieve the symptom by using LM potency or centesimal potency in limited repetition. We have remedies like Formica ruca, we have remedies like Gaultheria, we have remedies like Desmodium, we have remedies like Rustox, or you can think about Symphytum or Stilingina. Bleeding after scratching due to itching. Now, if you see the Mater Medica, or if you see the books of medicine, basic books of medicine also, you can see that after scratching the bleeding is quite common. If you scratch more, you might have bleeding. So we have remedies like sulphur, grapatis, petroleum, sarsaparilla. Don't prescribe on that symptom, because that symptom sometimes it would work, sometimes it could not work also. So don't prescribe on that symptom. Give me some more symptoms so I can be very specific in answering. Some medicines for muscle pull. See, medicine for muscle pull, you would be like, why there is a muscle flow from overlifting or XYZ, whatever problem. And there is, so you can think about that and then prescribe the medicines. Okay. Muscle pull medicine, simple medicine is that, like Arnica, Ruta, like Belisper, like these are common medicines. And you can use that. Okay. So let us go forward. Sulfur, graphite. Yeah, so my doctor is writing well. Do guidance about osteoarthritis, old age patients, where even selected medicines fails to complain of pain. Yeah, that's what I was trying to tell you all. Okay, whenever you are getting, pain because of old age. Now, old age because of, we can say abrasion, walking, बोलते ना हड्डी घिस जाती है. And these are the very common problems. And sometimes, sometimes you can use biochemic medicines also. Sometimes I try to use Calcarea fluor, or sometimes I try to use Calcarea carb or Calcarea phos, depending on the case in biochemic potency, so that that is taken care of. Otherwise, pain in old age, there are some medicines which are very very common. You can think about, I just told you, Formica rufa, benzoic acid, causticum, arnica, sulfur, rustox. Now these are very very common. Plumbum metallicum, bryonia, colchicum. It depends on case to case, whether the patient had history of a lot of walking, lot of standing, so that if there is a lot of standing problem, then the remedy changes in case to case. So it depends upon case to case, and this is a very common problem in old age, managed by either biochemical medicines and with your acute medicines in LM potency repetition. At least you can take care of the pain. Then depends. The pain is because of diabetes, secondary to diabetes, secondary to arthritis, or secondary to a lot of work pressure, secondary to a lot of walking or climbing stairs. That also is very important, these type of complaints. Already given Rustox, Arnica, it is already half a year. Yeah, so that was I was telling you, Sonam, physiotherapy and rest is important, because if the part is overused, so it requires rest. For example, if you are using the computer continuously and it is paining, so Physiotherapy is very important, and then rest, and then the medicine would work. Simply just giving medicine without doing anything. Hahnemann also says diet, regime, auxiliary measures. That is also very important in the practice, especially if you're treating the case of diabetes and the patient says, I'll eat everything and not do any diet. So you cannot control diabetes. So in diabetes also, like, we try to tell the patient, do some walking, eat some salads, avoid sweets, eat before 7 o'clock. That is very, very important. I hope you understand that. And then you can give your medicines, and it could work. Varicose vein with swelling of right foot. See, again, at the age of 78 years, I have a lot of cases of varicose vein which are, very good, in treatment, and they are responding well. In cases where the patient is, in a habit of standing and cooking food, she's continuously standing, so the blood comes in the veins, and that causes tossity of vessels. So in this case, the one thing is very important: the wearing the stockings. That is very, very important. And then you tell the patient not to, hang the legs, keep the legs straight, and it would work better. So remedies like calcarea carb, hemamelis, pulsatilla, fluoric acid, arnica, carbovage, and then see how is the vein. It is reddish in color, bluish in color, blackish in color. It is itching, and when does it pain more? If you get these symptoms in the patient, then you can treat the patient better. So let us good afternoon, Dr. Bharat Sonam. Yeah, a female patient feels severe coldness in the feet, severe backache, and frequent urination. If I can get the age of the patient, it would be better. Feeling cold, severe coldness. Now, there's a very interesting symptom in a mater medica. That is a lack of animal heat. It is as good as coldness. So whenever this symptom comes of lack of animal heat, you might have lot of remedies. Or simple, you can take, chilly patient and you can get the remedy. Or sometimes what happens because of peripheral neuropathy, that can also happen. And neuropathy can be because of vitamin B12 deficiency. So try to evaluate the case before prescribing. Don't jump into prescription, otherwise there will be a problem, So evaluation of the case is very important. Then depending on the case, you can think about remedies like silicia, arsenic, calcarea phos, sorinum, nitric acid. These are the remedies you can think about. Yes, so can we go forward? Yes, so I hope everything is getting cleared. It is very important for you to tell me that whether you're understanding what I want to convey. That is important. Few of the questions have scrolled up. So if I have missed some questions, you please write down again. Nothing. So let us go forward. So there were a lot of questions about, leukorrhea and menses problems. So as I wanted to take only leukorrhea today, because, otherwise it becomes very, very fast and haphazard. Okay. So I'll just come into leukorrhea also again. Now we have a lot of cases where the leukorrhea, the patient comes that I have been suffering from leukorrhea for the past 5 years, 6 years, 10 years, and the patient comes for a different complaint. But I had a very interesting case of cough. I had a very interesting case of cough. Please listen to the case. It is a very interesting case, And the patient has cough symptom. He had come for an acute complaint, so he had cough, seasonal type of cough, and there was a lot of bronchitis. There was a lot of rattling in the chest. Expectoration was creamy, sometimes mucopurulent and all. So I repertorized the case. I got the symptoms and prescribed the patient balsam Peru, BALSAN, balsam Peru. So I gave the patient balsam Peru 2 times a day for 5 days, and again the patient came to me. So the cough was much better, and the lady was so happy. She told that the cough is better, sir, but with the cough, I had so long standing leukorrhea for 5 to 6 years. That is also much better. And I was so much surprised, that how come with balsam Peru, the leukorrhea is also better. So I searched the repertory and the mathematics, and I got the rubric leukorrhea chronic, and in that also balsam Peru was there. See, sometimes it is called as a counter proving. I had given medicine for cough and the patient was better. And incidentally, the patient was so tired of taking medicines for leukorrhea that now she is not interested in treating that. But with balsam Peru, the remedy, and the patient was treated. So as I always tell to my students who are with me, who are studying with me in my YouTube, that sometimes if you don't get the simillimum, the body will keep throwing symptoms, and then automatically you would understand that this symptom was there and the patient was not cured in the chronic complaint. The body was throwing some acute complaints, so that symptom was also important, and that has cured the case. That's why I tell everyone that if the acute symptom, acute disease, the patient comes to you, take it very seriously, because that remedy which you could not get the simillimum, and that body is trying to tell you that I am this remedy, please give me, and the chronic complaints also get cured. Are you with me? Yes or no? Everyone? I hope you understood. Anyone? Yes? Yes or no? If you all don't answer, I don't understand only whether you're understanding the remedy or not understanding the remedy. There are so many doctors online, but I get only few responses. Okay, so yeah, one symptom also you will get very frequently in your practice, that whenever the patient says that whenever I'm exerting, whenever I'm shifting my house, or some guests have come to the house, I have done a lot of work, I get leukorrhea. Now this is this is a classical symptom where the patient says leukorrhea exertion aggravates. Exertion aggravates. And there is one more rubric in the repertory: leukorrhea during exercise. Now for a lady, if she not doing exercise, not going to the gym, if she is living in a village, very difficult to use that rubric. But if you do not get the result from leukorrhea from exertion, there are only two drugs, Erigeron and I think Helonius. You can take that rubric also for prescription. Leukorrhea during exercise, going up and down, looking at the clinic, looking at the husband's work, teaching the children, and managing the guest, managing the mother-in-law and all, everyone. That's an exertion as good as an exercise. In that you have remedy Magmur and Max Self. I have got very good results when I have used Max Self in my practice, where exertion aggravates leukorrhea. So this is something very clinical which I have seen in my practice. I hope you understand. And okay, Batch flower remedies from experience. No, this was the question asked to me before also. Batch flower, I have used it very, very sparingly in my practice. I have got results, but very, very sparingly. But I cannot tell you because I have not seen a lot of cases of batch flower in my practice. So I always tell you that clinically is very important, that I have used that remedy, I have used that symptom so many times. I'm very sure if you use it, you will get the results. In batch flower, I don't know. I have got the results. Maybe you cannot get the results. So my knowledge of batch flower is very good theoretically, but practically I'm using it very sporadically. So I cannot answer this question. A patient sleep after uncovering his abdomen, but he's chilly. Doctor, yeah. So go home and put both the rubrics. Patient sleeps out of abdomen while uncovering it, and the patient is chilly. You should get the answer. The patient is chilly yet does not like covering. Which remedy comes to your mind, anyone? The patient is chilly yet does not want to cover. We have done this remedy. Sometimes what happens that the patient tells you very, very a symptom where you find it very difficult to understand whether this remedy would suit or not. So don't take that typical symptoms. If you don't get it, forget it. But in the grand generalization, the bony concept, if you get that, for example, the patient is chilly but yet does not want to uncover, and you can use that remedy. So it is a homework. I have told this remedy before. I told the case also with that in the last YouTube. You can go and find out that. So nosode as an intercurrent remedy, yes, you can use that remedy as an intercurrent remedy, and you should get good results with that. Okay, so let us go forward. Any other questions? Some questions get scrolled up very fast, Yes, so It is already half an hour up. I hope you enjoyed as much as I enjoy sharing knowledge with you. Thank you. Until next Saturday, goodbye.